when I heard that, I first of all, I don't like to hear this because I'm never quite sure how to introduce it, because I had an experience a long time ago where I fully contradicted everything that this person's physical therapist was doing. And this person got very upset with me. Welcome to the Fascia-Informed Therapist podcast, designed for health and wellness practitioners interested in fascia science. I'm Amy Mayer, occupational therapist, practice owner, author, and educator with more than 30 years of experience using fascia techniques across many settings. Each episode brings practical insights and thought-provoking conversations to help you expand your skills and better serve your clients. Let's get started. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today we're going to discuss a topic that may be a little bit uncomfortable for some of you. Some of you have probably been on the receiving end of being contradicted, and some of you have probably been on the side of you need to contradict someone. And what I mean by that is, if you are a practitioner and you know a little something about fascia, and your clients are also working with other practitioners who don't know about fascia, or maybe don't know about the science behind fascia, or don't know it very deeply, then you may experience clients who are being told information that you don't agree with. And this is something that I have run into many, many times. And it happened again. I agreed to see a new client last week. One of my existing clients asked for a favor to see a friend of hers who was experiencing very similar symptoms to what she was experiencing when she came to see me. And her friend stood up and had to, after sitting for a while, stood up and immediately grabbed his back and then grabbed something to support himself. And she looked at him and said, "That's exactly how I looked about a year and a half ago. And I suggest you go see Amy. She does fascia work and she can teach you some things. She helped me a lot. Would you please go see her?" Of course, he didn't know anything about fascia, what it was, how it would be helpful. And she said that she would pay for his session if he would go, and that tipped the scales, and he ended up coming, and he was absolutely delightful to work with. But what ended up happening is he was already in some therapy with another practitioner, and had only had 2 sessions, but he felt like he was receiving some benefit from it. And I'll get more into that here in a little bit. So the topic of contradicting, and it can happen. It's happened when I've had clients who see a chiropractor, and I'm not anti-chiropractor. I've had it happen when clients are seeing another massage therapist, another PT, all different kinds of practitioners. I mean, even I'm never going to tell a client what they should or shouldn't do, but I am going to say, here's what I think, and here's why you get to decide what you're going to do next, regardless of the type of practitioner that they are seeing. I am never, ever, ever, let me repeat that, never, ever, ever going to tell a client, you must do something. Anything, even what I tell them. I'm only telling you what I think, and I'm going to tell you why, and then you can decide for yourself. And over the years, I've gotten more skilled at contradicting, of course, because the longer I practice and the longer I study my science, the better I get at it. But it's still never a comfortable thing to do. And one of the things I experienced, it was not too long after I opened my practice. I was probably opened my practice full time, I should say. it was probably like 6, 7-ish years ago. And I had a client who came in, and I don't even remember exactly what was going on with her body that she came to me. And I didn't even know that she was seeing another practitioner yet, because we were still in the evaluation process. And I started telling her, this is what I see in your posture, and this is what I think you need to start thinking about for yourself. And here's how I think things need to be shifting in your body in order to deal with the issue that you have. And then she said, well, that's not what my physical therapist says. And I was like, oh, okay. And I said, well, here's what I think. And she said, but I've been seeing this person for years. And in my mind, I'm thinking, well, if you've been seeing somebody for years and you're not making any progress and you're still at this stage, then that's a first red flag. But the more I talked about what I thought she should do, the more I was finding out that it was the opposite of what her practitioner said she should be doing. And she got very angry at me. And I don't completely understand why she was angry, because I was explaining why I thought what I thought. But she had developed such a close relationship with this practitioner that they had become kind of friends. And so she didn't like me saying, well, I disagree with the advice that you've been given. But again, I explained why, but that really didn't matter. So in my mind, I'm like, okay, I have to figure out how to do this in a more discreet, kind, supportive, open way, so that people can at least absorb what I'm saying and make their own decisions. So anyway, like I said, it happened again with this new client. So he came in with low back pain, which a lot of us see people with low back pain. It's one of the most common things that I see, and likely many of you as well. He had some imaging done. Imaging had some changes in his spine that were noted, but the surgeon said, yeah, you're a long way from the knife. Go get some therapy, and hopefully you'll be able to manage this, for a while after you learn a few things and from your therapy. And so he went to physical therapy, and I do not know where. I did not ask where or who he was seeing. I don't know probably a lot of the PTs in the area. I know far more OTs since I used to teach at Creighton. But anyway, it doesn't matter. It doesn't matter. So I started teaching him about fascia and went through my evaluation with him, and it was extremely obvious to me that his posture is a big part of the problem. When he came, the way he walked in, the way he sat down, the way he stood for me during the evaluation process, it was very obvious to me that he had a very pronounced posterior pelvic tilt, even though he said he felt the weight mostly in his heels because he had an old feet. His feet hurt a lot because he used to run when he was much, much younger. So he pushed the weight into his heels, but he was still pushing the hips forward into that posterior pelvic tilt, really flattening the low spine. So I showed him some pictures, and I said, here's what spines are supposed to look like in these curves. And the anatomy around those curves exists in a certain way in our bodies, and when those curves are in place, all that other anatomy, things like the discs and the nerves and the muscles, can all function at their best. Not that we have to stay in that perfect anatomy all the time. The body loves variety. But if our go-to isn't good posture, if we're not comfortable in good posture, then we're going to have anatomy that's going to malfunction. If we're consistent with that over time, and he was a person, I will just say he's older than me, and I turned 60 this year. So he seemed to understand that, and I explained to him. He didn't seem super interested in lots of anatomy lessons and digging deep into the science. So I said, I'm only going to teach you one part that's, I think, is the most important part of the fascial system for you. I said, there's some cells that exist in this, and he had done a little bit of homework. He looked at my website, did a little learning about fascia, so he knew what the web part was. So I said, I want to teach you about the fibroblasts and how they shape your fascial system and why. And I said, really, the term fibroblast, fibro, the collagen, the fibers that make up the fascial system, and blast means they're pushing that into your system. So these little cells really do two things for you. They read the pressures that come into your body, and they can either build that collagen up or they can take it away. And they're going to build your system based on how you tell it to through the pressures that you create in your body by how you hold your body. And how you hold your body against gravity with the tucked hips and the flat spine is how your body has rebuilt, how your fascia has rebuilt itself over time with this consistent way that you're sitting, that you're standing, that you're walking. And while I'm explaining some of these two things to him, I'm always looking at people's faces to see if they're zoning out or if they're really thinking. And I could definitely see the wheels turning. And when I asked for confirmation, he said, oh yeah, I get that. That makes sense. And so when I explained to him that you've built this over time, the good news is that the pressures that you put into your body can also rebuild your body back into, likely build your body back into those curves that will then match with how the anatomy is meant to function best. And he understood that as well. And so then what I'm doing is, while I'm doing the manual therapy part of what I do, I'm starting to ask more questions, and I'm starting to think about, okay, what are we going to do next, and what homework am I going to give this person? And so if I know they're already getting therapy somewhere else, I want to know what they're doing there so I don't repeat anything, that I don't overwhelm by giving too much. How could I layer it in so that we're working together rather than overwhelming the client? And so as I'm working on the client, I ask him, so tell me a little bit about what you're doing in therapy and what has your therapist given you to do for stretches or strengthening. And he said, yeah, we're doing a lot of stretching and a lot of strengthening the core. Okay, can you tell me a little bit about what the stretches look like that you're doing? And he said that I'm sitting on a mat and I've got my legs stretched out straight, and I've got a great big therapy ball between my legs, and I'm draping my upper body over that therapy ball. And in my head, right away, I'm thinking, okay. And then he described another stretch that was similar to that. And then he described some twisting type stretches. And I said, okay, let's go back to the one with the ball where you're leaning forward. I said, tell me, what position is that putting your spine in? Is it in the curve that we're trying to get you back to, that healthy low spine curve? Or is it flattening your back? And he said, oh, it's definitely flattening my back. I said, what do you think about that now that you know what you know about fascia? And he said, I probably shouldn't be doing that. He said, well, maybe. I said, maybe your therapist is thinking about how can we open that space up a little for you and take some pressure off to reduce the pain. Maybe that's what they're thinking, but that's a very, very short-term goal. And he did tell me that he does some stretches where he leans forward when he's walking if his back starts to hurt. So he's doing exactly what the physical therapist is teaching him to do. Well, he was doing that before he went to therapy, but now the therapist, maybe the therapist heard him say, this is what I do and it takes the pain away. So the therapist was teaching him other ways to do that. I don't know. So I've learned to try to think of all the reasons why another therapist or another practitioner might be teaching a client to do something that maybe doesn't match with where I'm going. And so I try to give the therapist the benefit of the doubt to the client so that they're not thinking, because I don't want to put the client in the middle and have to say, well, this therapist said that, and this therapist says that. And yeah, I just don't want that for the client, and I don't want to butt heads with other practitioners. Fascia offers a more complete view of the body and how we can support function and healing. In the Occupational Therapy Practitioner's Guide to Fascia-Informed Practice, I help you explore the powerful role of fascia in everyday client care. Through my live and online courses, you'll gain practical hands-on skills you can use right away. Explore fascia, integrate skills, transform care. Visit fascia-informed.com to learn more and start your journey today. So I did ask him though, I was like, do you think that's a short-term fix or a long-term fix? And he said, well, it sounds very short-term, but it sounds like I need to be doing the opposite of that. I said, yes. I said, maybe getting onto your stomach, and that would help put the anatomy of your hips in the right plane in order to rebuild that low back curve. That would be a great stretch to add in, but you have to make sure it's not too much. You can't do it if it causes pain. You'd want to stay away from that. It's always a gentle nudge. And I always teach clients, feel how I'm pressing into your body. That's the same sort of sensation you want in your stretch. You don't want to overdo it. So then we talked about, okay, well, you said you were doing some strengthening and strengthening your core. He said, yes. I said, okay, tell me about what you're doing for strengthening your core. And he said that the therapist was having him lay on his back and do leg lifts. And I had just gotten done sort of pressing into his psoas to see how much tenderness there was in that particular area, which people with low back pain, there tends to be a lot of tenderness in the psoas area. And I said, okay, given that the psoas area is a hip flexor and it's that tender, and that's the muscle that you're using a lot of when you do leg lifts, what do you think about leg lifts? And he said, well, maybe that's not the best thing for me. And I said, well, let's talk more. You're laying on your back now. Do you feel your low spine touching the table as you lay on the table on your back? And he said, yes. I said, okay, so when you do leg lifts, your low spine is probably touching the table. Yes. And I had talked to him earlier about when you're trying to rebuild these curves, you want to make sure that everything that you're doing, stretching, strengthening, is in the good spinal curves. You've got your good spinal curves going before you do any kind of strengthening. And I said to him, okay, so I want you to think about ergonomics. I asked him if he knew what that was, and he said yes. And I said, I've been doing ergonomics as long as I've been doing myofascial work, long time. And if I was going to go into a setting and ask a person who is lifting something heavy, let's say a heavy box full of paper, I would ask them to be in the best possible anatomical position before they lift. And that means they get their back in the best anatomical position, and then they use their legs to lift. So when you do anything, you get into that position where you're using trying to create strength. You want to build strength around a spine that's in a good position. I would never, ever, ever ask that person who's going to lift a heavy box to tuck their tailbone and flatten their spine. That sets the person up for risk for injury, and we don't want to do that. So I don't want you to set yourself up for more injury by flattening your back when you're doing something strenuous. And he said, okay, that makes sense. So you could potentially do the leg lifts, but tuck a towel or something underneath your low spine so it encourages you or reminds you to get yourself into that appropriate curve before you do something strenuous. And that made a lot of sense to him. Then we talked about isolating muscle strengthening rather than doing something with your full body. I said, I'd really rather see you do a full body activity because your core is really 360 degrees around your spine. And I gave him the imagery of a blood pressure cuff around your spine. And that's what Stuart McGill in The Back Mechanic describes it that way. And I mentioned that book to him as well. He could read that, but he didn't seem like the kind of person that would go get online and get that book ordered ASAP. But not that he wasn't interested in all this stuff. He certainly was. I don't want to make him sound uninterested. He certainly was. He just didn't seem like a science geek. So I suggested that he think about strengthening his core, front and back, and the sides in an activity that is more full body, and thinking about engaging that core. And we practice engaging the core appropriately when he's doing his weights, because he liked to do weights, free weight or machine weights. So I said, I think one of the best exercises to do for your core and practicing your core is the bird dog exercise, and especially for someone who feels like they're really a beginner at core strengthening and protecting their spine. And so we practice it, and I demonstrated for him. I said, here's the compensation I want you to look for in your own body. And I got down in the bird dog, and I showed him how when someone lifts their arm forward and everything stays still between the shoulders and the hips versus someone reaching forward and lifting their shoulder and twisting their upper spine to compensate, that looks like the arm is coming up, but it's really the spine doing the work that the shoulder should be doing. And the same thing with the legs. I showed him with the legs too. And he was actually able to get into bird dog, and he was only able to do one limb at a time, but he felt his own compensation. And that was impressive. That was very impressive to me. So he felt his own compensation. He felt how he compensated on one side more than the other. And he was able to then correct it by not lifting his leg as high. And that was wonderful. So we talked about just getting that bird dog down in place, getting to a place where you can do an arm and a leg at the same time. And then it would then start to think about doing other full body type exercises that get to the core. And there's lots of choices out there, lots and lots of choices out there. If I have anybody with back pain doing crunches, that's an immediate stop, full stop. And if they're doing it with any other practitioner, I will say, send them to me. I'll arm wrestle them over whether or not that's a good idea. And nobody's ever come back to me at that. But anyway, so the whole idea of contradicting another practitioner is something that it can be uncomfortable to do, but it's in the best interest of your client, and it's most definitely in the best interest of you to know your stuff in a way that you can explain the science behind it in a way that your client can understand so that they can make their own decision. So hopefully you noticed how I didn't say you must immediately stop. I might have said immediately stop doing the leg lifts, but I did say why. But the other ones, I was like, well, here, you think about it and you decide. So and as far as being on the receiving end, I have most definitely had people show up and tell me that their PT or their chiropractor or their doctor said that fascia, being able to affect fascia is ridiculous, and they've only really understood or known fascia in a human cadaver most likely, and haven't kept up with the current science. And if you're not looking for it, you're not going to find it. So anyway, I'm hoping to change that. So if you are on the receiving end of someone saying that fascia is not important and not changeable in the human body, well then, hopefully you have the science to explain why it is important and how it is we are able to affect it with a lot of different ways, both hands-on and hands-off. Okay, so I hope this was helpful. I hope that everybody has a wonderful rest of their day. Take care, everybody. You've been listening to the Fascia-Informed Therapist podcast. Be sure to subscribe so you don't miss new episodes. And if you'd like to go deeper, check out my continuing education courses, both online and in person. You can find them at fasciainformed.com. Thanks for listening, and I look forward to next time.